Can ejaculating every day bring benefits to your sexual health? Or could stopping ejaculation or reducing its frequency be harmful to your health? Follow along with me until the end of this video and I'll explain the myths and truths about this topic. Hello everyone, I'm Dr. Emily Carter, a urologist speaking to you from the United States. I see patients, both men and women, for in-person and online consultations. Now, let's get to today's topic. Several scientific studies have been conducted on the number and frequency of ejaculations and whether or not this is linked to the development of conditions like prostate cancer. One study from 2016 evaluated men who ejaculated 21 or more times per month, comparing them to those who ejaculated around 7 times per month. It was discovered that the first group with the higher frequency showed reduced risk factors for developing prostate cancer. Another study, published in 2017 along the same lines, looked at a larger number of men, approximately 31,000 patients, in a retrospective analysis over several years. Comparing those who ejaculated more than 21 times per month, it was also observed that these patients had a lower incidence of this type of cancer. But what is the real explanation? Can this truly be considered a strong medical recommendation? We know that prostate cancer is the most common tumor in the male population and the second leading cause of cancer death in men. It is estimated that about 1 in 9 men will be diagnosed with this tumor in their lifetime. A likely explanation related to this finding is that when a man ejaculates and releases semen, he also eliminates certain toxins and free radicals that may be concentrated in the seminal fluid. Additionally, it stimulates better cellular and hormonal renewal. However, this cannot be considered a specific cause and effect factor. Why? All the studies, including the 2 I mentioned, were retrospective analyses. The population was not followed forward in time from a starting point, nor were they specifically evaluated for that type of study. In other words, they analyzed databases based on patient histories. Therefore, certain biases, such as memory bias and selection bias, can compromise the results of this type of research. So, there is no very strong recommendation, especially a numerical one, regarding an exact number of ejaculations that are poor-cased works as a protective factor against prostate cancer. Nevertheless, this type of information can guide us doctors and also patients with the advice that a healthy, regular and frequent sex life can indeed improve risk factors and serve, in a way, as a protection against the development of some cancers, like prostate cancer. But what about the opposite? Stopping ejaculation or ejaculating only rarely? Can a sexually inactive life be harmful to your health? This is also a very frequent doubt among a large portion of our patients. As we know, there is a continuous production of semen by the prostate, seminal vesicles, and testicles. This production occurs regardless of whether the patient has more or less sexual activity. Some patients wonder, if I don't ejaculate, what happens to this fluid? If a man does not ejaculate, his own body takes care of eliminating this volume either through urine and spontaneous loss during physical strain, or even through the reabsorption and recycling of the seminal fluid. A very common question concerns cases where a patient experiences a period of arousal but cannot expel his semen. So I have a video on the channel where I explain this type of situation known as blue balls, that discomfort or pain in the testicular area that can be linked to a period of high arousal during which the patient cannot release semen. These situations are not inherently harmful to health, but they can certainly cause discomfort and a painful condition. However, not ejaculating or going days, months or weeks without sexual release cannot be considered a risk factor for diseases like prostate cancer. That's a myth. Prostate cancer has no association with whether a patient has a more or less frequent sex life. However, some observations can be taken into account, such as the issue of disuse and atrophy, the development, for example, of changes in penile tissue when a patient does not have frequent oxygenation, such as when he loses spontaneous erections or does not have a very active sex life, can in some contexts be related to developing disorders like premature ejaculation, delayed ejaculation, or even erectile dysfunction. This may be linked to a lack of regular sexual stimulation. So everyone, what I want to emphasize is that it is indeed very important to maintain good quality in your sex life. This can be encouraged and can be helped with medical guidance. Talk to your urologist if you have any concerns or problems, as this can certainly greatly improve your quality of life. If you found the content of this video interesting and think it could help someone you know, please share this information. Don't forget to subscribe to the channel, turn on our notifications and stay tuned for our weekly content. Take care!